50% of her diet on each meal. And she's refusing those protein supplements. Those are so important in terms of repairs, especially to those that have these hip fractures. She tells you she wants to go home, get back to her routine foods and activities. We all would, wouldn't we? We don't like to be in strange places. And you uncover that she hasn't had a BM in 3 days. So what additional assessment should you be performing? If she tells you that, you would be looking for what? What else? Dehydration. That's good. What else?
Lack of fiber.
Yes. Bowel sounds. These things really are one of the most significant problems that hospitalized patients face. And when they come in,
Look at our medication.
medication would be an
I know
issue.
certain things.
Make you constipated. Yeah. But this is one of the most common problems that we see in hospitalized patients. Who likes to go to an odd bathroom or be in a strange? You don't, do you? You have this routine that you do. So what you must do is figure out what you can do with the situation she's in. Dehydration, increased fluid intake, right? Figure out what you could do as far as in terms of foods that would produce, provide her some relief. Medications, laxatives, stool softeners, things like that. In the situation that she may have, she may need an enema. But I'm telling you, these things go unchecked so much in hospitals. We tend to veer away from it. But we shouldn't, because this is what causes the demise of a patient. It's usually their bowels have problems. It's just what happens. So now let's just look at the YouTube system's working this morning. That's nice. Just refresh your A and T on the GI system. Starts right here.
In the back.
Actually starts in brain.
Well,
In digestion, food is changed by the organs into a soluble form to be absorbed by the body. Food in the mouth is mixed with saliva. Saliva begins to dissolve the food as the teeth grind and cut it. Food is forced back into the throat, pharynx, by the tongue. Food in the pharynx stimulates the swallowing reflex. The larynx is pulled upward to meet the epiglottis and seal up the trachea. Food goes from the pharynx to the esophagus. Food moves down the esophagus by peristalsis. The peristaltic wave reaches the esophageal sphincter and food enters the stomach. The unique muscular structure of the stomach breaks up the food into small pieces called chyme.